Hi, my name's Sarah Rockefeller and I'm here at the SVRI Forum with Monash University, which is based in Melbourne, Australia. And my interest in GBV research began last year when I started a research project looking, so I'm a medical student, so my interest is sort of in the health sector and how the health sector can really improve in their response to gender-based violence. And what I noticed from my own experiences in medical school is that we were learning about diseases that affected, 1 in 100,000 people, but not about violence against women and gender-based violence, which some estimates, can affect up to 1 in 3 women and has very negative health consequences, depression, suicide, post-traumatic stress, as well as HIV, sexually transmitted infections, to name a few things. So I conducted my research from Melbourne and Sydney in Australia, but I ended up interviewing 44 practicing medical doctors from all around the world, asking them to reflect on their own medical education. Had they been taught about sexual violence, and did they think we should learn about it in med school, and what did we need to know? And so I conducted these interviews and transcribed them and coded them for themes. And so from these results, pardon me, I found firstly that all these doctors had met patients who were victims of violence, whether they were surgeons or family practitioners, and none of them really knew what to do. And they felt that they'd missed an opportunity to help the patient. And so they thought it was an essential component of undergraduate medical education. And they felt this education should cover several areas, so an awareness of the issue, what are the health outcomes, how do you ask someone if they've been a victim, and then sort of what services to refer the patient to. And they felt that this, in terms of structure, this education should be delivered right through all the years of medical school, so starting in the early years and reinforced later, as well as coming up in a range of different health disciplines, so women's health, psychiatry, public health, and those sort of things. So now that I've completed that research, I'm actually trying to develop a module on sexual violence that can be put into my own medical course. So for that we're making 2 films which can be put into tutorials, and hopefully those films on sexual violence could be used by other institutions as well. And my goal one day is to see this topic, gender-based violence, included not only in my own medical school's curriculum but in curriculums everywhere, so that doctors of the future are capable of looking after women and patients who are victims of violence.